Are you struggling with brain fog, weight gain, and mood swings? Have you been told by your regular doctor that your labs are normal, so it must just be fine for you? Maybe it's normal for your age? Listen, I call BS on that. You deserve to have energy, focus, and be at a healthy weight. Here's the problem. The medical system is gaslighting you, not the individual doctors. They mean well, they just don't have the right tools. I used to be one of those doctors. I'll never forget Bridget. She was one of my aha moments as a regular doctor. I was a gynecologist, and I've been one actually for 30 years now. But back in the day when I didn't know about functional medicine and root cause and how to treat and help people be their best, Bridget suffered and I contributed. She was in her late 30s, and I had a special relationship with her. I had delivered her most recent baby a couple years ago. Well, she came to see me in between her regular exams, those routine gynecology exams. She was having a problem, and she confided in me that she didn't feel good, that her periods were wonky, and that she was gaining weight and she couldn't think straight and she was having mood swings. And you know what I told her? I told her she should go on birth control pills. I said that will help fix your periods, and a lot of times it takes the hormonal mood swings away because now you're not having fluctuations in your hormones. That's what I had been taught. I will never forget the look on Bridget's face. She was disappointed. She was hoping I would be able to give her more than that. She didn't want to be rude to me, so she just said, okay. And I gave her a prescription. But you know what? I never saw her again. And to this day, I feel bad about it because I know she went somewhere else and she went to seek the help of some functional medicine chiropractors in town. And I hadn't even heard of functional medicine at the time. And then a few years later, when I learned about it, I thought about Bridget. I thought, oh man, if only I had known about inflammation and balancing hormones, and that there's so much we can do about these things rather than just prescribe birth control pills or sleeping pills or antidepressants or anti-anxiety medicines. That's all I had. So that's the reason that you feel gaslit. The doctors don't know how to treat it, and they're uncomfortable when they don't have the answer for you. So they give you a Band-Aid. That's what they've been trained to do, give you a prescription. You deserve more than that. So believe me when I tell you that I really truly think the doctors have good intentions. They just don't have the right tools. You realize that very little training is in the OBGYN regimen for perimenopause and menopause symptoms. Look, we're really good at helping women get pregnant, of helping deliver their babies, helping people with period problems, taking their uterus out, hysterectomies, things like that. But actually helping women be healthy and thrive, honestly, not really. And it breaks my heart now that I know what I know. Traditional medicine is really good for life-threatening things, traumas, serious infections. That's when you need traditional medicine. But for the chronic things that are not life-threatening, they don't know how to help you. And lastly, the problem with traditional medicine is they only get about a 15 to 20-minute visit with you. You cannot get to the root of what's going on with someone and their true issues in a 15-minute appointment. In the acute setting, when there's a severe problem and an emergency, traditional medicine can give you medications or perform surgery to get you out of the crisis. However, when you have a chronic issue that's not life-threatening, it's inflammation-based, they mean well, but the training is to give you medication to mask the symptoms, not to treat the problem, not to get rid of the underlying root cause. Well, when you give a medication to treat symptoms, what you get is more symptoms, side effects of that medication, and that leads to more and more and more medications. Pretty soon you're on a laundry list of medications, some of which are there to treat symptoms from other medications. That's no way to live. The modern medicine system categorizes organ parts, right? You have a psychiatrist for your brain and mental health issues and mood issues. You have an endocrinologist for hormone issues. You have a gastroenterologist for gut or stomach issues. So let's say you have bloating or abdominal pain and you go to see your gastroenterologist. Well, they're going to do a really good job at making sure it's not an ulcer or inflammatory bowel disease causing your symptoms, but they don't realize the issues that stress affects the gut in an important way, and that perhaps the stress is raising cortisol, which is causing leaky gut and also disrupting your microbiome. They're good at fixing either significant acute issues or trying to mask symptoms, but not get to the root cause. Example number 2, let's say you have thyroid problems and you go see an endocrinologist and the doctor diagnoses you with Hashimoto's, which is an autoimmune condition that affects your thyroid gland. The endocrinologist will be very good at getting an ultrasound to make sure you don't have nodules, determining if you do have nodules, do they need to be biopsied, and if you have overt hypothyroidism with significantly abnormal labs, they'll give you medication, most likely Synthroid, to try to help you feel better. But do they do anything about the thyroid antibodies? Do they talk to you about immune dysfunction? Do they look at how stress affects immune system? Do they look at how inflammation from your gut affects immune system? No. In fact, one of my aha moments in traditional medicine, I had to have quite a few, let me tell you, because as a traditionally trained U.S. Air Force doctor, I was dyed in the wool that traditional medicine had all the answers. But once I started to question, and once I realized with people like Bridget and other people that I couldn't really help, and I opened my eyes and started looking more, boy, you can't unsee that. So one day I was looking up Hashimoto's in a medical encyclopedia online. And verbatim, it said, Hashimoto's is the #1 cause of hypothyroidism in the United States. But don't worry about it. Just treat it if it's hypothyroid. If there's no hypothyroidism, nothing you can do. Tell them to come back later when they have hypothyroidism and you'll give them hormones. And I just about lost it. Excuse me, if your thyroid gland is being attacked by your immune system and destroyed, you don't think that's important? Just ignore it until enough of the thyroid is destroyed that you need medicine? That is backwards. We can do better than that. I've seen Hashimoto's reverse. I've seen antibodies decline. I've seen thyroid function improve when you get to the root of what's inflaming the immune system and what's causing those antibodies in the first place. So in these situations, you really need a hormone locksmith. You need someone that does more than just evaluate for whether or not you need Synthroid. You need to make sure that you have the right hormones, that you metabolize the hormones right, and that you have cells and hormone receptors that are able to accept the hormone to trigger the response. What you really want is you want the response of the hormone. You want energy, you want clear thinking, you want stable moods, you want stable weight. That's what we want. We don't just want optimum hormone levels. We want hormone levels that function. And in order to do that, we need the key, which is the hormone, to fit into the lock, which is the hormone receptor, to trigger the response. And if you have massive inflammation from environmental toxic exposures, I hate to tell you this, but you have rusty locks. And you can take all the hormones in the world, but with rusty locks, you're not going to have the hormone benefits. You're not going to have the clear thinking, the mood stabilization, and the healthy weight. You're not going to feel good.